Okay. What Medicare covers? Well, hospital, 100% of the first 60 days. Doctor's visits, 80% of the Medicare approved amount. And then some preventive services are covered as well. What does it not cover? Well, long-term care. And that's purposely at the top of the list because without a good plan in place, long-term care could really catch a family off guard with what the costs are for long-term care. And I assist folks figuring that out and what might be a good long-term care strategy in their world, in their situation. Care delivered outside the U.S., not covered by Medicare. Dental care, vision care, hearing aids, cosmetic surgery, acupuncture, amounts over the Medicare approved amount, amounts not covered by deductibles and coinsurance. So, I mean, it's, hearing aids, they are not inexpensive. They're costly. So it's important for folks to know kind of what's not covered, what private insurance may or may not cover it. So deductibles and coinsurance amounts, such as for Part A. Now, remember, I said Part A's deductible was a little over $1,600 per spell of illness. That could be a big deal. That could get covered. Hospital costs after 60 days, the 20% of doctor's bills, etc., prescription drugs, the deductible, maybe the deductible can get covered. So, and that's where these Medigap policies come in. This is why you would have these policies to cover that 20%. Again, they're sold by private healthcare companies. So when you hear that term private, what do? You can shop the coverage. There are multiple carriers out there who offer supplemental coverage. New Jersey, I think we have, 10 or 12. In New Jersey, I think we have 26 different prescription drug plans. So it can be overwhelming for folks. Again, they're sold by private insurance companies. They supplement original Medicare, Part A and B. They follow federal and state laws to protect you. So to give you an idea, they're standardized. Okay, so if you have a Part G, Plan G, they're called plans in the supplemental world. So if you have a Plan G from United Healthcare and you have a Plan G from Humana, both plans will cover all of the same thing, but what each carrier charges you, the premium, that'll be different. Okay, so they're standardized, they're identified in most states by letters. If you live in Massachusetts, Minnesota, Wisconsin, their plans work differently. I'm in New Jersey, so I don't spend a lot of time on discussing those differences in those plans, but just be aware if you're in those states, please consult with a health insurance guy in your state to help you with that. Does not work with Medicare Advantage. So you don't need a supplemental plan if you have an Advantage plan. And the reason for that is that because there's no 20% that the doctor coverage doesn't pay. What happens with Advantage plans is that, it's coming up. I'm not going to get out of turn here. Does not work with I'll cover that in a minute. You pay a monthly premium. Costs vary by plan company and location. So this gives you an idea. I tried to do a little summary chart on the Medigap plans. So I mentioned a Plan G. You see that there's a whole bunch of 100% in there. F is no longer available. They discontinued F. There's no E. I've had people comment, hey, what's Plan E? There is no Medigap Plan E. But these are the different plans you can sign up for. And that's kind of how they cover. You might, as you might imagine, the more the plan covers, the more expensive that plan will be. Okay, but these are the different plans. I help clients kind of figure out what's best for them all the time with these things. And then Medicare Advantage plans. So health plan options approved by Medicare, also called Part C, run by private carriers. Again, shop these plans. Medicare pays amount for each member's care. You may have to use a network of doctors or hospitals. By the way, that's a good thing and a bad thing. It's a good thing that they pre-negotiated the rates with these hospitals and doctors. It's a bad thing if you have a need to go outside that group. I'm asked all the time, what's better, but you just kind of have to consider, what is your health situation? I'll tell you right now, if you travel a lot, then an original Medicare may be better than an Advantage plan for you, because the Advantage plan is normally geographically centric to where you live. So if again, I'm in New Jersey, but if you're traveling to Texas, you may have a coverage problem, although you probably would have the ability to get back to Jersey for any serious issues. May have to use that network. Plan may include prescription drug coverage. That's another benefit to the program. You could have prescription drug coverage included. May have extra benefits like vision and dental included. Benefits and cost sharing differ. The Medicare Advantage plans, essentially, if a doctor takes an Advantage plan, you basically could sign up for them. By the way, not all doctors do take Advantage plans. They could basically say that they have had their fill and not take any additional Advantage or Medicare folks. My experience has been, if you currently have a doctor and they've been your doctor forever and you move over to Medicare, they will continue to take you as a client because you've been with them. That's just been my experience. Shop carefully for private insurance. Medigap policies are standardized, but premiums vary considerably. I had mentioned, a couple of carriers, Mutual of Omaha has been in the business forever. AARP United Healthcare, they've got a nice supplemental plan. Humana's got a nice supplemental plan. So there's a lot of carriers out there, but they vary quite a bit in the price they charge. Drug plans, same thing, can vary quite a bit. Make sure you shop that prudently. The Advantage plan, again, that's the third area where private carriers are involved. So that's really kind of the areas of focus that I would have. Okay, planning for higher costs in retirement. Let's take a look at that. So out-of-pocket healthcare costs. So you can see as you age, and this is what this chart is meant to show, as you age, your need for services, which is the rust-colored, versus your premium costs, your need for services elevates. These are men, these are women. So you can kind of see what's going on as you age. Your need for services elevates. And once you have, a heart issue or a hip issue or a knee issue, it tends to elevate the cost of services for you. That's just something that just goes on. So the typical Medicare budget, I said that I'd go over this earlier, and here it is, Part B. $174.70 a month per person. Medigap could be as high as $200, and then prescription drug plan, I use a budgetary number of $40. So you're looking at almost $415 a month just in premium costs per person. So if I extrapolate that out for an annualized number, you're looking at just under $5,000. And if you add some out-of-pocket costs on prescription drugs and dental and vision, you're looking at about $6,500, almost $6,600 per person per year. So a couple, you multiply that by 2, so you're looking at $13,200, $13,300 in costs for healthcare. And incidentally, you're not sick. So this is just what it costs to have healthcare in retirement. So it's a little over $1,000 a month for a couple. So we got to make sure we have that cared for and buttoned up. What can cause your healthcare to change? Well, certainly higher insurance premiums, higher out-of-pocket costs. Change in health status may require more expensive drugs, more services not covered by insurance, dental, vision, hearing. Long-term care, I mean, that is the one, that's the killer. Long-term care tends, if you have an incidence, long-term care tends to be very costly. And I really do speak to my clients a lot about having long-term care coverage to take care of that event if it were to happen. Okay, so planning for future costs. A couple of different folks out there have done studies on this with what healthcare costs are in retirement. Fidelity has done something. You can certainly go do your own. Fidelity is saying $315,000 for couples in their retirement years that would pay for healthcare. And oh, by the way, that does not include long-term care costs. So, if I look at long-term care, it's not covered by either Medicare or Medigap. Excuse me, I just want to take a quick drink. This is what I was saying earlier, that Medicare does cover 100 days of skilled care as long as that's what you need. If you need skilled nursing care, directly supervised by a doctor, then it'll pay up to 100 days. The moment that you go help with activities of daily living or custodial care, there's no coverage at all. There's no coverage at all. So 35% over 65 have some type of activity limitations. So it's something to consider when you look at long-term care. The causes of activity limitations, I know the chart is kind of tough to see, but this big one here, and incidentally, blue is men and the brownish rust brown, though that's the women's stat. So hypertension's here, arthritis is down here as well. We have heart disease. So these are the areas that will basically cause the greatest amount of activity limitations. If you don't need help now, well, just wait, because as you age, and if you look at that tannish line as opposed to the rust line, so the tannish line is those who are 85 and older. Certainly walking becomes a challenge. That's my highest one here. But, bathing and showering and incidentally, these are the 6 activities of daily living. I said I'd bring these up later on. So we have bathing or showering. So basically self-care, dressing yourself, eating, getting in and out of beds or chairs. That's called transferring, by the way. So the ability to get out of your lazy boy by yourself without assistance, that to be able to stand up, that's called transferring. If you need assistance doing that, then you don't pass that activity of daily living. Then you have walking, and then you have using the toilet. So basically toileting, being able to go and take care of that by yourself. Those are the 6. Levels of care. So level 1, it's kind of in-home assistance. I call this neighborly care. Maybe you help a client pick up some grocery. You help a neighbor pick up some groceries. You help them, maybe make them a meal and bring it over and heat it up for them. Bring them to the barbershop. This type of thing. Just neighborly care. Then the next level of care. These are the activities of daily living, and it's eating. And I call it the things we take for granted. Being able to feed yourself, bathe yourself, dress yourself, toileting, transferring, and maintaining continence. So those are the levels of care. And then this is the skilled care. Now, this level 3 level of care, this is where Medicare does pay up to 100 days of coverage. But look at what needs to go on. You need 24-hour supervision. So the moment that you don't need that, you go to custodial care, disease management, ordered by a physician, etc. So in order to maintain or stay within skilled care, there's a lot that needs to be going on. So just be aware of that. All right. So what are the costs of long-term care? Well, these are national costs. The costs in Jersey are a little bit higher than these. I had an uncle I had responsibility for. He passed in August. And I can tell you that the cost that I had for the assisted living for him was almost $8,200 a month. You can do the math, but I actually was paying that for him out of his assets, of course. But and then if he needed help with med management, or he needed help with showering, an attendant basically standing by as he showered in case he took a slip or he got dizzy or something, that was extra. So it's not inexpensive. So Why plan for long-term care? Well, you spare family members from doing it. I mean, which of your kids is going to drop out of their profession and fly home and help you? I just think that is becoming, given the fact that we're becoming a more global society and people work from wherever they want, even people working from home. They'll move to Europe and work from there. I have a client right now who's going to move to Italy for the summer because they can and work from there and travel. So it's even the work from home situation that we're in, I actually think has made this worse because people's homes can be anywhere in the world. Avoid having to spend down assets to go on to Medicaid. Be able to direct your own care and obtain the kind of quality care you want. There's a host of reasons why you might want to consider long-term care. Okay, so in conclusion, I just want to reiterate the 3 reminders, and if I'm doing this live, I normally give a little quiz. So here's what I would do: enroll in Medicare on time, and then I just say why. And of course, everyone says, "Well, you want to avoid the penalties, so we don't want any penalties." So good. So test question number 2: shop carefully for private coverage. So where are the 3 areas of private coverage? And then I'd just be silent, and I'd see who could get them. And people are really good; they pay attention. So. And again, the 3 areas of private coverage are prescription drug coverage, okay, Part D, Medigap or supplemental coverage that covers the 20% that Part B doesn't cover. And the last is Part C, Medicare Advantage. Those are the 3 areas that you want to shop for the coverage because you can do better and save some money. And then lastly, plan for higher healthcare costs in retirement. So what are the 2 major reasons of why healthcare is going to be more expensive as you go on in your retirement? Well, one is inflation, and the other is the need for services. The need for services is going to elevate as you age. So just be aware of that. Okay. Questions? So, certainly, thanks so much for, being here with us. We have a QR code. I'm sure everyone's familiar how to hover over that and use that. There's my email address, info@westminsterwm.com. There's our office phone number, and there's our website if you wish to kind of explore what we're all about and what we do. But if you have any questions, shoot a note to info. And I have 3 advisors in addition to myself, including myself. There are 3 advisors in the office, and we all patrol the info@westminsterwm email address to make sure that we are very timely in our answers to questions that do come in. Thank you so much for listening. I really do appreciate it. I enjoy doing this very much. And again, thank you so much for listening. And I hope you used my channel here or my information as kind of your first foray into investigating Medicare, because there's a lot to consider. There's a lot of items that are involved and incorporated into the program. I hope you enjoyed what you heard today, and stay safe and be well. Thank you again for listening.